Hello guys, I welcome you all again to my channel, and today we will be doing this infection control video in which we will be studying about instrument reprocessing. So previous pages we read about the single use items and we just need to use them for a different patient and throw them after the use. So now here we will read for the reprocessing instrument and how we need to do the certain stages of the reprocessing. First, we need to categorize the instrument according to their risk relative to instrument use. So, where we are using that instrument, we will divide that risk accordingly. So, that risk is generally divided into critical item, semi-critical item, and non-critical item. Okay, so first the critical items. So which are the critical items which have the entry or penetration into the sterile tissue cavity or the bloodstream? For example, surgical dental procedure and the removal of the impacted tooth, extraction, endodontic procedures or vital pulp tissues. So we need to make sure that these things are sterile at the time of use because we do not want any bacteria to go with them. We cannot use them if they are not sterile. Okay, so the example they have given here, like the forceps, elevators, flap retractors, surgical burrs, instruments that are implants or any dental surgical handpieces. So whichever is going inside the patient tissue, cavity or the bloodstream, they needs to be sterile and they are considered as critical items. So these instruments must be sterile at the time of use and must be either single use disposable or capable of being steam sterilized. Then these instruments must be sterile at the point of use. This means that after use they are cleaned, rinsed, dried, inspected, then bagged prior to sterilization and kept stored in bags until use. Okay, as an alternative in an emergency, critical items may be used immediately after sterilization. You can just sterilize them and run them on the cold water. Run cold water on them, and that they would become bit colder because after the sterilization, instruments are generally hot, and you can use them in the emergency situation. Okay, so all critical items require BCI, which means the batch control identification. There should be a number on them. How you can track them, that on which day it was sterilized and in which number of load. Okay, and it should also be recorded in patient's note. Then the semi-critical items, which are those items which contact the intact non-sterile mucosa or non-intact skin. For example, mouth mirrors, filling instruments, dental tweezers, probes, and impression trays. So these instruments should also be sterilized between patients where possible, and when not possible, then you can use the thermal disinfection or instrument level disinfection as well for them. Okay, so for the critical items, there is no, any other way that you can do. They should be sterilized. But for these ones, you can do either thermal disinfection or the instrument level disinfection as well, and they should be single use disposable or sterilized after use. And after processing, semi critical items should be stored as to prevent contamination prior to use, so they should be kept in bags, in closed drawers, or in dedicated containers such as instrument cassettes. Then instruments used in semi-critical procedures do not need BCI. So there is no need for the BCI for these instruments, but there is so much need of the BCI for the critical items and are not required to be sterile at the point of use. This means that placing them in the bag is option. And in some rare instances, the items cannot withstand the sterilization using steam. And for that items, you only have the option of thermal disinfection, or instrument level disinfection may be used as an alternative. Okay. Then the non-critical items. So non-critical items would include the prosthetic gauges, then measuring devices, face bows, eyewear, bib chain, Willis gauzes. So these do not generally cleaning alone with the detergent, like the detergent wipes. You can just wipe them. And water is sufficient, but in some cases there may be some need for thermal disinfection with heat, and water is appropriate. Okay, then instrument reprocessing area. How does the reprocessing area should be, and how does the workflow happen? Okay, so these steps may include cleaning. First, you need to clean the instrument. Then you need to inspect to find out if there is any debris or anything which is still on present on the instrument. Then you need to do the functional testing, then packaging, then labeling, then disinfection, and at the end, the sterilization. The instrument reprocessing area must be appropriate in layout and size of the volume, including and part of the dental premises must be designated as the reprocess. So, in every clinic, the steri room or the sterilization room should have two parts. One should be the dirty area, and the other one should be the clean area. Okay. So in the dirt, if that is not possible because of limited space, then the cross contamination chances would increase. So it is very important duty of our that we will segregate the instrument accordingly, and we will, manipulate and treat the instrument according to their contamination. And to cleaning, and the cleaning process must flow in one direction, from contaminated to clean. Okay, so for the cleaning, it should be going from the dirty area, then they would be cleaned, inspected, then functional testing, packaging, labeling, disinfection, then sterilized, and then they would go to the clean area. Okay. To achieve this, the reprocessing area must be divided into distinct areas. For first, where the receiving area, cleaning area, and decontamination area. Then preparation and packaging. Afterwards, the sterilization and the storage. So how should be the design of the reprocessing area? There should be good lighting and signs or features to indicate the direction of instrument flow. Like there should be signs like this is the dirty area and pack the instruments and blah blah. Everything should be written there or signed. Then good lighting to minimize the risk of sharp injury during the instrument handling, and magnification to enable proper inspection of cleaned instrument. Efficient ventilation. So these are the some points that we are discussing about how should be that room. Okay, then non-slip water impervious flooring, smooth work surfaces without crevices and made of non-porous material. Then workbenches of a standard height and storage cupboard located at heights to minimize bending over. Sinks must be deep enough to avoid frequent splashing onto the bench tops. Hand washing must only occur in a dedicated separate basin for hand washing, and should not be done in the sinks used for instrument reprocessing, because those are dirty sinks. Both hot and cold water taps in the instrument reprocessing area should ideally be non-touch or elbow touch or electronic in operation, and sufficient drawers, cupboards, and shelves to keep work bench tops as clutter-free as possible. Sufficient bench space for drying and packaging area, and a cooling rack for sterile items. Then we will read about the transfer of contaminated instruments and the shafts. Instruments should be carried to the reprocessing area in a cassette or in a container that is preferably lidded and puncture proof to minimize manual handling of the item. So it should be covered so that there would not be any incident to the from the dirty instrument. Okay, and the contaminated zone of the reprocess for the staff member working in the reprocessing room suitable, they should wear suitable utility gloves when loading items into the ultrasonic cleaners or into instrument washers. Okay, so uh, then so these gloves, the person who is doing who is working in the sterilization room, so they should wear the utility gloves to either to load the ultrasonic cleaner, or if they are using the instrument washer. And appropriate thick utility gloves are also required for manual lubrication of handpieces, for loading automated handpiece lubricator, or for the manual cleaning of delicate or specialized items. Once the cleaning process commences, then instrument must pass in one direction only, which is the contaminated to clean. Then how you can clean the instrument? The presence of organic material left on the instrument may prevent the steam sterilization during the sterilization. So it is very important that the instrument is cleaned before undergoing the sterilization procedure. So the PPE requirements during instrument cleaning is clinical staff who are cleaning and reprocessing must provided with the formal training. They should have the good training how to do the cleaning. And whenever they are loading the instrument, like the ultrasonic cleaner or the instrument washer, they should wear heavy duty utility gloves, and staff must wear eye protection, face shield to protect them from splashes. A mask must also be worn to protect the splashes to the lower face and from aerosols. While not always required, a waterproof fluid resistant gown. It is not a necessary, but sometimes they also wear the gowns to avoid the splashes of the water on the skin. Okay, then wearing a head net is recommended when packaging instruments to prevent any shed hair falling onto the work area or into packages. For the same reason, beards should be covered. During operation of the ultrasonic cleaner, the lid must be kept on to prevent dispersion of aerosols and droplets. Then pre-cleaning at the chair side. Used dental instruments becomes heavily contaminated with blood and saliva. Use makes later cleaning more challenging, so it is important that you should clean them on the chair side only. To reduce this problem, instrument may be pre-cleaned by wiping using a one hand method at the chair side. They will remove the residue of blood, cements, and other materials that may become harder over time. And one hand method must be used during the wiping action to prevent the risk of sharp injury. The pre-cleaning technique is strongly recommended to improve the safety and the effectiveness of the instrument reprocessing. So it is very important that you need to start your cleaning step from the chair side only. Then, so if the procedure for delayed cleaning, dental instruments and devices contaminated with blood, saliva, and cement and other contaminants that are not able to be cleaned immediately, they should be covered with the suitable hydration solution to prevent any drying on them, because that would, if the blood gets dry on the instrument, that would impair the sterilization procedure. Okay, and then rinsing prior to cleaning. Rinsing instrument prior to cleaning aims to reduce any adherent deposits of saliva, blood, and other materials on them. And only warm water should be used for the initial rinsing. Why? Because hot water can cause the will coagulate proteins, and that can entrap more microorganisms, and the cold water will precipitate and solidifies the lipids. So ideally, only you need to soak all the instrument in the warm water. Then the mechanical cleaning step. So mechanical cleaning of instrument can be carried out in either in the instrument washer, that is also known as thermal disinfector, or using ultrasonic cleaner. So there are two ways where you can do the mechanical cleaning. Instrument washers are more efficient at pre-sterilization cleaning than both the ultrasonic and the manual cleaning. So the instrument washer are better than both of these. Mechanical cleaning is preferred to the manual cleaning because there is when you will clean the instrument with your hand, there is a risk of exposure to blood and the risk of penetrating skin injuries from the sharp or pointed instrument. That's why mechanical cleaning is preferred. For the mechanical cleaners used in dental practices, may be instrument washer or ultrasonic or any combination. Automated washing devices specifically designed for use. Okay, so they there are both bench top and the floor. It is not very important, so you just need to know that the ultrasonic cleaner and the instrument washer, there are two options we have for the mechanical cleaning. Then items must be free of visible soil before being placed in an ultrasonic cleaner. So as we need to do the wiping, which is at the chair side, then we need to soak the instrument in the warm water. Then we can load the ultrasonic by wearing the high utility gloves. Okay, so in addition, the lids, tanks and gaskets and strainers must be cleaned daily. Water must be degassed before use. Cleaning fluid must be changed a minimum of twice daily, like 2 times, because the fluid can get dirty with the continued use of material and the cleaning procedure. So we may need to change the water. And daily there is an aluminium foil test which is generally done for the ultrasonic to evaluate its performance daily, and the result is recorded to understand if it is working fine or not. Okay, then the lids must be closed during operation, and instruments must be completely submerged in the fluid, and no parts of the operator fingers or hand is permitted to be immersed in the fluid during the operation. So you should not open the lid of the ultrasonic when the process is going on. Then the next step is and do not leave items overnight in solution in the chamber of an ultrasonic cleaner. At the end of the day, you need to empty the water and rinse it thoroughly, then left to dry overnight. Okay, then manual cleaning, it is discouraged wherever mechanical cleaning can be used because this can lead to more injuries. The requirements for manual cleaning should be minimal since all routine instruments should be processed using a mechanical cleaning. It is necessary to clean a delicate or specialized items. Cleaning technique used should aim to avoid spraying liquid into the air, and the instruments should be held low in a dedicated instrument cleaning sink that has been pre-filled with the lukewarm water and instrument grade detergent. So you need to first like here in this picture they have shown that in this sink they have filled the water and they have added a cleaner in it, and afterwards they are cleaning these mouth mirrors with the help of this brush. Then to remove debris, a long-handled instrument brush or a non-scratch nylon scorer should be used until the item is visibly clean. Abrasive cleaners such as steel wools or the abrasive cleaning powder should not be used. A wire brush maintained in good condition may be used for cleaning tungsten carbide or the diamond burrs. All cleaning brushes used for mechanical cleaning must be washed, rinsed, and then stored dry. Then lukewarm tap water is to be used for manual cleaning. So you should only use the lukewarm tap water, no cold or either the hot. And as discussed earlier, for the initial step, hot water can coagulate protein and the cold wood solidifies the liquid. Common household domestic detergent must not be used. So there are different type of detergent that you will be using. Instrument detergent will have a neutral or mildly alkaline pH, unlike those used in ultrasonic who have strongly alkaline pH. Then rinsing after the instrument have cleaned from either from the ultrasonic or for the manual, you first need to rinse them thoroughly. It is very important in order to remove any residue of microorganism and their products. Of particular importance is the bacterial endotoxin, which is related to gram-negative bacteria. Then you need to dry the instrument. How you can dry those instrument? Either by clean instrument that will be sterilized using steam must be dried thoroughly as any residue moisture on instrument following cleaning, it may impede the sterilization process and may also stain or damage the instrument. So it is very important that you will dry the instrument. And how you can dry them? Either by using low lint disposable or lint free cloth or a short rinse in a very hot water. Okay, then you need to inspect the instrument by using the magnification glass to find out if there is any residue of material left on the instrument. Okay, after the inspection, you need to do the packaging. So how you will pack the instrument? There are certain color coded packets like these packets. They have certain, I'll show you one thing. So you need to pack these instruments into these color coded packets, and these packets have certain things. Let me find something for you. Like the dental practice must be mindful of accreditation requirements in relation to the packaging of semi-critical items, because as we read in the previous pages that the critical instrument must always be packaged, and for the semi critical there it is your option, right? So you should follow that rule. And for practice that perform periodontal close debridement, so then the instrument should be packed. And some private, and so it is your choice. So they here they have talking about those things. And as mentioned earlier, instrument that must be sterile at the time of use, which are the clinical critical instrument, they must be bagged and wrapped. And instrument with hinges or ratchets, like if any instrument has any hinges or ratchets, they must remain open and unlocked. And sharp instruments should be packaged in such a way to prevent any perforation of the pack. Okay, then color coded. So this is what I was looking for. So every pack, like this pack, has a color coded tapes on the individual instruments. For identification must not be used as they can prevent the penetration of steam under the tape. So some dental operatories, they have different rooms and they just put the color coded tape on them. This should not be done because that tapes can interfere between the penetration of the steams and compromise the patient's safety. Then the BCI, which is the batch control identification. So after packaging them, you need to, there is a number for every load. You need to write that BCI number on the package. So that would help in understanding when this load was packaged and when this load was sterilized and who did the sterilization and at what time, what was the cycle, and whether it was successful or not. And at the end, when you will use in any of the patient, then you need to write or track these autoclave numbers into their notes to make sure that you have used the sterilized instruments in that patient treatment. Okay, so it is very important. There are certain ways why how you can do it. Sometimes it is just the adhesive that they just put like with the labeling gun. Sometimes they do it with the like the that thing, what we call like the stamp something, they can also do the stamping, or sometimes they just write with the piece of like with the pen or pencil, they just write the code. What you need to write is codes for the date and the cycle or load number and the steam sterilizer identifier, like whether it is new sterilizer, old sterilizer, or sterilizer A or B. So you need to write these three things, and either it can be done by the labeling guns or adhesives or any stamping. Okay, it's just its purpose is that you can go to that data in which load this instrument was reprocessed and what was the how was the result, was it successful or not, and we can key compliance with that. So these are some of the thing, and even some of the sterilizers also include the code data. So we can just log into that sterilizer and we can read that batch code data as well. But it is not very important thing according to the exam point of view. Then the sterilization. Okay, so the sterilization process. So how will the sterilization process occur? Sterilization is the process of rendering an item free of all form of viable in microorganisms, including spores. Okay, so it involves the combination of heat and moisture maintained at correct temperature and pressure for a sufficient length of time to kill all the organisms with the microorganisms with the probability of survival being less than 1 in 1 million. Then the dry heat sterilization is not recommended for routine sterilizing. So it is not dry heat is not recommended. The normal sterilizer would be recommended, which are the autoclaves. So benchtop steam sterilizers, which are the autoclaves, are widely used in office-based dental practices. Most instruments are designed to withstand the steam sterilization. If an item is specified as being suitable for steam sterilization by the manufacturer, then the instruction from the manufacturer are undertaken. Then there are certain type of cycles that would happen in the sterilization. First is the N cycle. N cycle means that the items are not wrapped and non-hollow. Okay, so these cycle can only be used for unwrapped solid items. Steam pushes the air downwards and using gravity. So these are some of the items, for example, which are the unwrapped and they are solid items. So which could be the unwrapped solid items, like if we are using any of the semi-critical items, so they can be done in the N cycle. Then the S cycle means any specified items. For example, these cycles are intended for processing certain load types and load configuration. For example, they are for, like, for example, the scanner tips. They should be done under the gentle process. So when you are sterilizing that tips, you cannot put any other load. So that they are specified cycles. So that is S cycle. But in routine, we use the B cycle. They are used for the type A hollow objects where the ratio of the length of hollow portion to its diameter is 1:5. In such items, air removal is more challenging. Air is exhausted from the chamber by a mechanical vacuum pump to create negative pressure before steam is then introduced. Sterilization that runs B cycle requires specific performance test, including vacuum test, which is the air leak test, and air removal test. Okay, so generally these are the cycles that we perform in daily routine. Then how you can maintain and regularly test your sterilizer. So there are certain factors for the verification, like the commissioning. Then the commissioning report should include the installation documents. Like your sterilizer should be continuously re-evaluated, and its performance should be checked continuously. Okay, then the performance qualification, there are certain tests that the electrician would do, and they would make sure that your sterilization is working fine. Okay, so these are some of the cycles. sorry, the some of the tests like the microbiological report, then a report validation summaries would include commissioning, operational and professional performance qualification. Then monitoring of cycles, so there are otherwise the parameter must be read or the second. This is not very important as exam point of view, so that's the reason I'm not very focusing on these topics. Operating the steam sterilizer, so you this is important that how you can maintain it, that it should be continuously, its verification should be done by these tests. You can try to remember the names of these tests. And monitoring the cycles, like there for steam sterilizer, the time, temperature, pressure must be measured with then continuous automatic permanent monitoring, and you should monitor them that they are working fine. Then steam sterilizer performance tests. So these are the tests that they should be, sometimes they are done daily and sometimes they are done uh, like at certain period, after certain period of time. So we will start from this topic tomorrow, hopefully. All right. Thank you so much, guys, for watching my video. And I really hope that these videos are helping you guys. All right. Thank you.